Hi, I'm Dr. Maggie Park, Public Health Officer for San Joaquin County. Many people are concerned about the novel coronavirus and want to know how to get tested. While not everyone needs to be tested for COVID-19, it can be helpful to know when it is necessary and how to have it done. If you do not feel well, try to stay separated from family members at home and don't go out in public. Wear a cloth face covering if you must be around other people, even at home. If you are experiencing shortness of breath or other symptoms beyond the regular flu or cold, contact your primary care provider for assessment and referral to a testing site before visiting a physical location. Most locations require an appointment and a doctor's order. If your symptoms are severe, call 911 immediately. Our county is also participating in the California COVID-19 testing program with support from Verily's Project Baseline. County residents can use the online platform to be screened to see if they qualify for testing, but this does not guarantee that they will be tested. Testing capacity is still limited, so healthcare providers continue to prioritize testing for people who have symptoms. Remember that there is no treatment for COVID-19. Most people will have mild illness and can recover at home without needing medical care. Again, if you think you should be tested for COVID-19, talk to your primary care provider or visit the Project Baseline website for screening. If you do not have a regular source of care, call 211 or go to 211sj.org to be linked to care.